So in a man who has a worrisome PSA, one that's above a certain cutoff or one that has increased over time, a physician may recommend a prostate biopsy. Usually before that's done, a urologist will have a feel of the prostate with the finger to determine whether or not there are any lumps or bumps on the prostate. And in the PSA era, usually there are not lumps or bumps. So if someone has prostate cancer and the prostate feels normal on an exam, then that's assigned a clinical stage T1C. If there's a lump or bump present, then a higher stage based on what the doctor feels is assigned T2 or T3 based on how much hardness or how much cancer is present that can be felt. The grade of the cancer, which really is one of the most important, perhaps the most important determinant in its aggressiveness, is not assessed until the biopsy is done. And a biopsy is an office-based procedure that requires an ultrasound machine with a probe that goes in the rectum. Usually 12 or 14 pieces of tissue are removed in just a few minutes under local anesthesia and then is examined by a pathologist. And the pathologist will assign the grade of the cancer based on a standardized system known as the Gleason scoring system, grading the cancer from 6 at the lowest to 10 at the highest. And again, grade is the primary, although not the exclusive determinant of the aggressiveness of the cancer. For men with higher grade cancers or higher PSAs, it's appropriate to also obtain bone scans and CAT scans to determine whether or not cancer is present in the lymph nodes or bones. Those tests are not necessary in men who have lower grade cancers because the likelihood of having cancer outside the prostate is very, very small. So when a pathologist looks at a biopsy, they assign what's called a Gleason's grade, which is a measure of tumor aggressiveness. And it's based on the pathologist's experience in assessing what the cancer glands look like under the microscope. Most prostate cancers will have at least 2 areas of different gland patterns that are graded on a scale of 1 to 5. And the pathologist assigns a grade of 1 to 5 in the primary pattern and then a grade of 1 to 5 in the secondary pattern, and then they're added together to give the total Gleason score. So the lowest cancer grade that exists is actually Gleason's pattern 6, which is a 3+3, where the primary and secondary grade or primary and secondary patterns of the tumor both have the same primary Gleason score of 3. Grade 7 cancers are considered to be intermediate in aggressiveness, and grade 8 to 10 cancers are considered to be the most aggressive. Rarely a prostate cancer will have 3 different areas in it where the pathologist will assign the primary and secondary pattern and then what's called a tertiary pattern, usually of a higher grade tumor, and the behavior of the tumor is determined by what the highest Gleason's pattern is in the cancer.